Welcome, everybody. This session is now ready to begin. This session will be hosted by John Freedman of Freedman Healthcare. John, the floor is now yours.
Thank you, Norm. Good morning and good afternoon, everyone, depending upon where you are. Delighted to have you back here for the last day of the session. Our topic today is what the National Weather Service can teach us about health price transparency. So if we can move ahead to the first slide that we've got here. I'm delighted to be joined by a really esteemed panel who will get a chance to introduce themselves momentarily. Next slide, please. And you can read their bios, but they'll get a chance to introduce themselves as well. And if you go on to the next slide, what we're going to talk about today is that first, I'm going to give you a little bit of a background as to sort of what was the genesis of this talk, what was the work we did that led up to it. After I do that and walk through some of this, the panelists will each just briefly introduce themselves before we go into a moderated discussion. Of course, a discussion is only valuable as much as it gets interaction from everybody else, so I encourage you to submit your questions using the Q&A tab on Zoom there, and then we'll turn over to some audience questions before we have closing remarks from each of the panelists. Next slide. So I have a feeling that many, perhaps most of you who are listening to this have probably either been involved in transparency efforts around cost and or quality, or have a mandate now and an interest in creating something. You know, back in the early 2000s, New Hampshire went live with price transparency for hospitals there for a whole variety of services. In Massachusetts in 2008, they went live with a combination of cost and quality on a live website. And these efforts have been replicated by many bodies. They've also now been, as you may know, been pushed by the feds. And so there's been a big push by the Trump administration to mandate a lot more transparency. So there's a very fast moving environment that we're in. But why the National Weather Service? So those of you who know about the National Weather Service, they really have got two primary roles that they fill. And if you go to the next slide, we'll take a look at what I mean by that. So they both gather lots of information. They've got tens of thousands of sensors and satellites and weather stations all over the place. They aggregate enormous amounts of data and put together forecasts. And they also disseminate that data. So these are two screenshots from weather.gov, the National Weather Service's official website. And it's a really great website. You can go to it on the left-hand panel there. You might see you can click in on any of the geographic areas, zoom down, choose an area that you want to get a forecast on. On the right-hand side, you can see it's got some visual display and some textual information that tells you about the forecast. And so the Weather Service is both an aggregator and a disseminator of data. That said, if we go to the next slide, I'll bet that most people don't actually use weather.gov. Probably much more popular are sites like these, AccuWeather on the left and weather.com, which is the Weather Channel's site on the right. And they use basically the data that gets fed to them from the National Weather Service, but they choose to display it in a somewhat different manner. They try to get their own audiences, and they try to add some value-added services. For example, on the left, you see that there's like an air quality index that they've built into this that is supplementing the weather information. On the right, you'll see that they've got a feels like temperature. It's a little bit small to see, but they've got an algorithm, a proprietary algorithm that's sort of like a wind chill and sort of like a heat index, and kind of tells you what does it actually feel like out there. And although these two examples are actual web pages, probably tens of millions of folks, including most of us, really get the weather even more commonly from a widget on our own phones. So you've got one of scores of commercial widgets there that will feed you the data that again comes from the National Weather Service. So the question that we're asking ourselves is, and we can go to the next slide, is why not follow this same method for transparency? So is it possible that the state can be an entity that gathers all this data, but then instead of being responsible for putting up the data, turns it over to third parties who can fill this role? And so with that in mind, we came up with the Price is Your Right Visualization Challenge. And thanks to support from Massachusetts CHIA, from the Mass eHealth Institute, and some funding from the Donahue Foundation, we put together a data visualization challenge. Go to the next slide, please. And I'm going to walk you quickly through it, but all the details of this can be found on this website, pricesyourright.org, which is the repository where we're leaving up things. So it has the contest rules, it shows all the submissions, it shows the results of the judging as well. Next slide, please. And just to quickly walk you through what some of the entries were. And by the way, these entries came from student groups and they came from professional organizations, people from different backgrounds, and therefore showed a great variety of creativity. These are designed, as you can tell, to be mobile optimized. Among the functionality that was really pushed was a connection, not just data about a doctor's name and address, maybe a phone number, but actually connecting there. Photographs, connection to board of registration or licensure data, even connection to be able to book an appointment with that practice, or merge it with quality data about those individual practitioners. Next slide. Some other features that were highlighted were ways of enhancing the display to show more information. This one on the left was a rather creative and complex way of taking a multifactorial analysis and presenting it in spider diagrams to try to pick an optimal provider across multiple characteristics. On the right, something less sophisticated but still compelling, color coding of pricing to help steer you towards what might be a better option. Next slide, please. And another popular one was mapping. So just like you'd go on your favorite search engine and try to find a restaurant, you might say, here's where I am, I want a restaurant within here. There they are, and you can zoom in, you can drill down, you can get additional information. And so this will be my last slide, so we can actually stop screen sharing for now. But the point is that there was a great variety of creativity and different tools that could be brought to bear on this challenge. So with that, I'd like to turn it over to our panelists and give them each a moment to introduce themselves. So I think Ray, we'll start with you, if you don't mind.
Sure, I'd be happy to. Thank you so much, John. It's a pleasure to be here with you and the other panelists and all the I can't see everyone, but all the great folks attending the NATO conference. It's a conference I've attended several times over the years. Really always a great event, even as a remote virtual event. So anyway, my name is Ray Campbell. I'm the executive director of the Center for Health Information and Analysis. It's a state authority of the Commonwealth of Massachusetts. We have regulatory power to collect data from participants in the healthcare system. And so we use that to assemble various data sets. And we use that to generate a bunch of different reports and also to make data available to other state agencies and to private sector participants in the system and to researchers. So we are a data and analytics organization. And in particular, the legislature has tasked us with maintaining a consumer transparency website. And so we built one of our own, but we did think that instead of just us having necessarily the best ideas, we thought it would be a good idea to engage the idea of crowdsourcing or a competition to take other looks at it. So we were very excited by the competition and the results, and looking forward to this panel.
Great, thank you. Melissa?
I am Melissa Hillmyer, and I'm a project manager at Human Services Research Institute, and I lead our transparency efforts primarily on Compare Maine and New Hampshire health costs. I was also the lead for our team, the HSRI data miners, working alongside 3 other colleagues to conceptualize and mock up the winning app of the challenge.
Great. Ateev.
Hi, Ateev Mehrotra. I'm a physician and a researcher at Harvard Medical School. Over the last 5 years, I've done a lot of work on what's the impact of price transparency on patient choice. And one of the key themes of that is that price transparency efforts have not had the impact we would like, largely because of lack of awareness. I'm struck by a group that was arranged in one state where a focus group where they were showed the price transparency information, and response was anger that people did not know about this website and this information. And it's, of course, how would you know about this kind of information on a random state website? We're all very, very busy. And that's really what motivated my interest in collaboration with this initiative, which was how can we better disseminate this information?
Thank you. And last and not least, Laurance.
Thanks. Laurance Stuntz. I'm the director of the Massachusetts eHealth Institute at the MassTech Collaborative. The eHealth Institute is a state quasi-public economic development agency here in Massachusetts that focuses on innovation and helping to encourage innovation and use of data and technology in healthcare. And so we were particularly interested, to Ateev's point, about nobody knowing about any of these price transparency websites or the data sets that are available. What really attracted us to this challenge and what was compelling about the National Weather Service model is the fact that, you know, the data are often and increasingly being made available, but nobody knows about them, nobody's using them. And so a challenge like this was a really good way, we felt, to increase awareness for the data, to drive innovation, we got about a dozen applications to the challenge from both student groups as well as professional groups. And we thought it was a great way to highlight the data that are available and to try out a bunch of new things.
Great. All right. Thank you all. So let's turn over to the questions. And actually, Ray, if it's all right, I'm going to start with you. So, you know, this challenge wouldn't have been possible without your work with Chia to actually make the data available in the public domain. Can you just talk a little bit about, you know, what did it take to make that data available, and you know, should other states follow suit? You know, why should they?
Sure. I mean, I think it's definitely something that other states, to the extent that they're not. I mean, a lot of other states are working in this direction, but if others are on the fence, certainly I would encourage you to jump in. In terms of what it takes, it does take, as I mentioned earlier, CHIA is a state agency. We have regulatory authority. We can collect data from health plans and from provider organizations, and that's really the foundation for our ability to do things like this. So we leveraged our all-payer claims database, which is just a large repository of claims, which is just, you're seeing a whole bunch of payments flowing back and forth, or not back and forth, but a whole bunch of, you know, requests for payment and then payments going back and forth between providers and health plans. And that lets you see the prices in the system. And so that really was the key for us to be able to create the table of prices that we use both for our own website, but then we also use to populate this competition. So having the ability to gather claims data really was the essential requirement. Then having the will to do it, to go forward. There's, you know, some people have argued that there are anti-competitive reasons why states shouldn't publish this information. So you needed to have a commitment to price transparency, but that combination of having the authority to collect the data and the will to publish it is what it took for us to move forward.
Great, thank you. Melissa, you know, you represent the organization that in fact was the Grand Challenge winner of our contest. So I would really love to hear, you know, what was your process like in figuring out what consumers wanted, and how did you put together your solution? And maybe you can share a little bit about that with us.
Sure. So if we want to pull up the next set of slides, I can go ahead and walk through it a little bit. So our team at HSRI has extensive experience collecting, analyzing, using, and displaying health cost and quality data. So we combined our experience along with feedback that we've received from consumers and stakeholders to conceptualize and mock up this mobile app Care Price Points. We know that consumers want information tailored to them, so we designed the app to simplify the decision-making process and point users to a recommended facility. So I'm going to just briefly show how the app is designed to work. So if we can go to the next slide, please. So the app's framework organizes measures and incorporates consumer-friendly plain language. So to start, users select the service that their doctor ordered, and in this example, an MRI was selected. Then users choose the area of the body where care is needed. Next, please. The app's algorithm recommends facilities based on user preferences. And so in this example, three facilities are shown, and the highest value is highlighted. So users may tap on a map marker to learn more information about a facility, including the overall quality of care and the average cost of the selected procedure. Here we've utilized symbols and have taken a less is more approach to really limit the cognitive burden and take the guesswork out of choosing where to go to receive care. Next slide, please. By tapping on a facility's name, users can go ahead and drill down to detailed information, including if the facility offers high-value care for other procedures. This display was intentionally created to really guide consumers away from the common misconception that high price means high quality. Quality of care data is also accessible on this particular screen, and it's based on measures that consumers care about, which we know are patient-centered care, timely care, effective, and safe care. Next slide. Users have the option to update their preferences at any time, including prioritizing the factors of healthcare value, which would automatically adjust the algorithm in the app, making it convenient for users to choose information based on what matters most to them, such as if a facility is close to their home or work. So care price points is also voice enabled, so users can talk with Alexa to find care, a feature that's particularly helpful in situations that require quick action. So these designs that I've shared today, they are wireframes, and we're currently in the process of looking to fund the project to really bring the app to life. And so if anyone has ideas on how to help us achieve that goal, please reach out.
That's great. And congratulations on your win, Melissa. You did a beautiful job. So, related to that, you're describing what does it take to bring it to life. Actually, Laurance, I'm gonna turn to you next. What are the common hurdles and what are some potential solutions for both data aggregators and disseminators working in this space?
Yeah, it's sort of interesting because a year ago, or probably 2 years ago at this point, Chia and we had worked on an earlier iteration of a data challenge like this. So we frankly didn't get a lot of input and interest, but one of the things that I felt was really done well this time around, and I would applaud Freedman and the work that you guys did in just getting the word out. It might be that there are 100 people who might be interested, only one of them who might hear about it in a lot of instances. And so really putting an effort to get information or get the word out to potentially interested parties to do a challenge like this is the key piece to it. I think also just trying to have a good sense and good information for participants or potential participants about what's in the data, trying to make, so that they can understand more easily how to access the data, what is in there, what's not in there. There were some interesting pieces that we weren't able to include in this initial round of data release around, for instance, exactly what each payer paid. It was average prices, at least on the Massachusetts side. And so understanding that and making it clear to people what they can or what are available are some of the key points, I guess, in terms of getting the data out and attracting interest.
Great. Do any other panelists want to comment on that?
Yeah, one thing I might jump in with is as part of the challenge, I had an opportunity to work with a number of private companies who were interested in this space, from large companies, and you can think of like different search engines, et cetera, all the way to smaller companies. And one of the things that I was really struck with is a bit of a disconnect between the perspective of states and the perspective of companies. So states, obviously, you're very invested in your personal area, your Maryland or Delaware or any other state, and it's all about what do we serve the state's residents. And one of the things I saw was a great disconnect is that the companies that might be interested in disseminating this information don't care about individual states. They are thinking in a very national perspective in terms of that. So if they have the opportunity to have information from 3 states, that isn't as interesting to them as if they can get that information across many states and reach hundreds of millions of people as opposed to 1 million, 5 million, or even 30 million plus in California. And so I think one thing that I might emphasize in terms of the perspective of private companies is, or the lesson to states from that, is that really thinking about how do we coordinate these efforts across many states is going to be very helpful, as opposed to And so just to be very concrete, how do you put the information out there in your data feed? If each state is doing it differently, it's going to cause a lot of problems and we'll have fewer people using that information.
That's great. I think that actually tees up sort of the next thing that I'd like to talk about, which is, how do we enhance this collaboration between states and potential third parties, and understanding, what does it take to actually make it work? So, if you're trying to find appropriate funding and political support to do this, as Ray described, it was not they had the political courage to come out and do it. And there is frankly, a spectrum of feelings about that from state to state. Some are incredibly restrictive in how they want to use the data, and others are freer with it. So again, I'd like to ask, how do you feel about, how do you break that down? How do you get it to be perhaps, a multi-state collaborative, and how do you entice third parties, particularly commercial third parties, to participate in this?
I mean, to make it multi-state, it would have to be standards-based, but I guess I think it's a complex issue because, well, first, I think we need to pull back, and for me, it's fundamentally about transparency more than it is per se about consumers, because what we saw when we did this, when we gathered the data to create the table that sits behind our consumer transparency website and that was used in this competition, what it is this table presents a picture of provider price variation in the Massachusetts healthcare market. And it's an utterly fascinating picture. And really that's kind of lost on consumers in the sense that they don't personally experience the entire range of providers and the entire range of prices, but it's fascinating to policymakers. And similarly, it's fascinating to market participants. And so Chia proceeded on the premise that this information needs to be out there. It needs to be out there for policymakers, it needs to be out there for market participants, and it needs to be out there for consumers. But there's lots of different ways I think that consumers interact with the healthcare system. It's not just through procedure prices, it's largely through insurance premiums. And so, we think there's also issues around getting information out about that. But so I think as wonderful and as powerful as these consumer price transparency websites are and that approach, I think we also need to remember that this is part of a broader transparency agenda. And then they're all mutually reinforcing because I think that it's the same data behind it, but there's multiple audiences for this data. And just wanted that perspective to be remembered.
So two things to add. I think first that, as Ateev mentioned, finding a partner to really bring the data to life is a hard thing to do in this particular space. I think partially because it really takes a certain kind of partner to both understand the data and have a sense on how it's used by multiple stakeholders, but then also how to go ahead and bring that data to life so that it's helpful and engaging for consumers. Secondly, I'm a firm believer that if you build a tool for consumers, that it will work for those multiple stakeholders by building in those layers of allowing users to go ahead and drill down to get the level of detail that they're most interested. Because even if you're having legislators take a look at the site, for instance, time is pressing. And so if they can look at something and quick get a picture and understand what it is that they're looking at, then we've done our job.
I might add one other piece, which was that, one of the great lessons I thought from this, and this is work that others, on the team led, but this was illuminating to me, was that we gathered a great Melissa and many other groups that had a lot of expertise and interest in how do you get information out to people and visualization skills and advertising and really fascinating backgrounds on people. But when we started presenting them the price information and the underlying data that Ray and the data that we also got from New Hampshire, people were pretty confused. These are smart, really driven people who have a lot of expertise. And so to build on Melissa, so there is this other aspect of this, which is that for those of us in the know who deal with these kind of complex data all the time, it kind of makes sense that there's charges and prices and variation and why there's all this complexity. But it was really a fascinating experience for me to see how to break this information down for just the people who are going to disseminate that information, because they didn't have that background. So that's one piece, which is that it isn't just put the information out there and everyone's going to understand it. There is this necessity to actually explain where that information comes from and how to use it. And then the second thing that I would that comes from that is that kind of lesson also just was another reinforcing lesson, is that this is complex information, and why we need these kinds of data disseminators to put this information out there, because they are going to try to simplify it and make it more readily available, more readily interpretable by consumers, but also, as Melissa and Ray said, state legislators.
Yeah, it's not enough to just build it and have people come. And I think that's the real opportunity with a lot of this transparency work, is once it's created, then putting that funding forward to really go ahead and get it out into the hands of consumers and end users.
Is that a responsibility of each individual data aggregator? Is there a role for a collaboration, possibly even for an organization like NATO, in assisting that?
Yeah, I'll take a shot at it. I actually think that the data aggregators, like the state APCD or the data sources, those with regulatory authority, have a responsibility around making that available, but not necessarily around figuring out how people will use that data. I think, like, thinking back to the National Weather Service piece, they're making massive amounts of data available, and then individual companies like the Weather Channel have figured out how to get consumers interested in that. So I think an organization like Anato can help. It would be immensely more interesting if there were 50 states who were all publishing their data in the same way that Massachusetts and New Hampshire did, because then you'd have 330 million individuals, or at least the data from all of those claims, available. And that could be really interesting. You could do, the federal government could take a look at price variation across states and from a policy side, but consumers, as they move, could really understand some of that data. So I do think that, organizing the disseminators is a key role that we don't really have yet. I think it is hard, as Ateev said, for individual states to play that role, just because we can try. That's what we tried with this, but I think that for this to really take off, we have to have massive scale.
Again, this may be another opportunity for standardization,
yeah,
one way or another, and perhaps that can be a convening role that NATO can play.
Yeah.
Thank you. Anybody else want to touch that before I pivot in a different direction? So so I see, by the way, we have one or two questions that have come in, and just remind folks, in about 10 minutes, I'll open it up to the floor. So if you have questions, please type them into the Q&A tab. So let's, right now we're all meeting remotely. We're here virtually in Boston, but we're wherever we are because of COVID. That has upended everything. So to what extent do you feel that, the pandemic has affected public awareness and desire for healthcare data? We've certainly seen a lot of COVID-specific dashboards, but what's, and policy reaction, but what's happening, in the public? Has the pandemic actually changed how we consume data in some way? And maybe a way of introducing this, Ray, a sister agency of yours in Massachusetts, the Department of Public Health, is promulgating some new rules for gathering additional data related to COVID. So, do you want to maybe tackle that question and give some framing about what's going on there in Massachusetts?
Sure, I'd be happy to. Although I want to hasten to add that I don't work for the Department of Public Health, and I'm not really, an expert in the details of what they're doing, but just broadly what's happening, I think, in Massachusetts is what's happening around the country, which is that there's a sudden ferocious level of interest in what's happening as COVID-19 spreads, differentially, but, throughout the country and throughout the states. And so states have, by and large, there's kind of well established, I think, sort of public health infrastructure in this country, underfunded, but well established in the sense that it's been around for a long time, and it's swung into action. And so I think you saw some commonalities in how the different states reported on it. I think, some states had better public health infrastructures than others, but I think it's safe to say nobody was expecting an emergency on this scale of this intensity. And so I think that all of the reporting has been a scramble. And I think that you've seen, number one, a huge amount of interest on the part of the public, on the part of policymakers, on the part of, but in particular the public. And people want to know right down to the, my mother's in this facility, what's happening there. I mean, that's not a level of data reporting and data collection and reporting specificity that governments are typically used to. So I think there's been, it's been a big challenge. I think that there's been a lot of work done to catch up to it. And, I'm hoping for a good fall, but I think everybody's preparing for a more challenging or for, potentially challenging fall. So we'll see if the report, if the data collection and reporting systems are functioning a bit better. But in general, you saw over the course of the past 5 months, the public reporting getting richer and richer. And one of the issues now is actually, as you get too granular with the reporting, you start to run up against privacy issues. But it's a big challenge. There's a big interest in it, like there's never been an interest in this type of reporting. And just one example I'll give is that my organization, CHIA, only last year launched what it thought was going to, it was the first annual report on nursing facilities. We're now doing daily collection and reporting on nursing facilities in Massachusetts. So we thought it was going to be annual, it's now daily. And so I think that just the whole cadence and level of intensity and interest is dramatically different than it was before the start of this crisis.
So there is a lot of public demand that you're feeling. Melissa, working, in a private organization that works around health data, how do you see that playing out? How has that affected your work? Where do you see it trending?
So I think that the visualizations that have come into the play with the pandemic has really just shined a light on healthcare data in a way that it hasn't before, and that people are seeing it, and not only seeing it, but having conversations about it. And so I think that, while this audience here today is more familiar with transparency and health data, it's still pretty generally new concept to the public as a whole. And so I think that as the public gains increased awareness of data, and that this data exists and that it can be put out there, I think that it's really our job as data organizations to rethink the data and how we disseminate the data and how we continue to build trust in the data.
Thank you. Ateev, you're a researcher, by day, and how has the research agenda been changed? And I think it's not just COVID, but certainly disparities in healthcare and health equity has certainly been another issue. What are you seeing as a change? How much of this is temporary? How much do you suppose is permanent?
Yeah, so maybe I'll touch upon both the questions that you posed, the ones directed to me and also what Melissa and Ray chatted about. The first thing I wanted to emphasize is that one thing that I came away from this so far, with the experience we've had so far, is this underlying idea that motivated this exercise of aggregation versus dissemination has been echoed out there. I think all of us are getting the information about mortality, cases, testing, in all these different places where data aggregators, there's the aggregation component, but then organizations like the New York Times and others have started taking that information and putting it out in very, just to echo what Melissa said, really inventive ways that I think are really guiding decision-making, both at the individual level as well as the policy level. On the research side, going to your question directly to me, there is this a big push, and the turnaround time in terms of having to make decisions kind of echoes a little bit of what Ray said. Usually if I use data from 2 years ago, I'd be like, oh, I have great data to inform decision making. And now I submitted an article a couple months from data from a couple months ago, and it was ancient history because people are like, oh, that's early pandemic. I need to know current pandemic in terms of what the impact was, and that was on something related to spending. So I think it just really reflects this kind of phenomena that all of us are feeling, which is the need for recency of data has become really critical. Now, you asked the question whether that's going to be a long-term thing or is that going to be just a blip. It's hard to know. It is this whole idea that when we start getting data, more recent data, then it's hard to go back to where we were before. So I'm not sure. The last point I might emphasize is that on the disparity side, we've been publishing some recent work. This has been related to telemedicine work, but I think it has applicability here, which is that there are substantial disparities in the United States in our ability, either having both the technology as well as the skills to use information. In this case, we were focused on telemedicine, but here it's applicable that when we put this information out there and we create a website, we have to recognize there's a large subset of our population that can't use that information. And so how do we get that information to the entire population, not just the subset that are tech savvy, use search engines and, you know, are on Zoom calls all day?
Fair point. You know, I'll admit my own bias here, but I think, you know, us on the panel and our audience listening to us, you know, we deal with health data all the time. And I think all of us have always wanted to be able to get more, you know, bounded by limits, of course, on privacy and security. But, you know, we've always wanted more timely, more broad, more rich data. And it really does feel like things are different now. And it begs the question, which I don't know the answer to either, as to whether this is a blip or whether this does become a trend. But I think what we have seen in actions of several state legislatures now taking action to launch various data projects, whether it's a claims database or otherwise, you know, seems to be following in that wake. You know, also on this, so, you know, what are the areas, what are the priority areas? Maybe, Laurance, I can turn to you. You know, what types of data are the priority, and, you know, what level of granularity, what are we thinking about differently given, you know, given these most recent months of crisis making us think about that?
You know, I think it's sort of interesting to think about, try to figure out where you're going to gather the most interest. I actually, as we were talking, I just pulled up, you know, what Massachusetts releases every day around the COVID crisis. So it's at mass.gov. They release a zip file with, you know, looks like about 20 Excel files, you know, encompassed within it that have data around hospital bed usage, deaths, tests, long-term facility usage, which probably comes from Ray's data reporting, race and ethnicity data. So all of this has been an evolving thing due to the conversation around COVID. And I guess I would say that, you know, the types of data, like, you know, the data that we released in the Price is You're Right challenge are interesting to folks who are interested in that cost and cost disparity and so on. I do think that we have an obligation as state data aggregators to talk to consumers, to understand from them what will really drive the conversation. I don't know the answer off the top of my head. It may be interesting, Melissa or Ateev, as you know, in your conversations with individual companies, what data, you know, did either this data set not have that would have been interesting to them, or where should we be pushing? I would just, you know, I don't know the answer to that specifically around the price data. I think one of the things we were thinking about long-term is, could we break it down further by payer, and so that we can figure those questions out or not.
I might,
go ahead,
just to build on that, you know, the one thing that I might say is a lesson that we've learned from the pandemic that might be useful for the price information also, is that we've had to be relatively iterative. We didn't know what all the information that was necessary ahead of time. Information started coming out. We were all desperate for information. We got some information, and then the natural next question started to arise. For example, to build on some of our comments before, which is both became evident from the clinical side as well as policymaker sides, is that we need to break this information down by race and ethnicity. And then the next layer of information came out. But I think this is kind of just a basic lesson, but I think the pandemic has really emphasized, try something, see what happens, you'll learn what people want and what they don't want, and then you do it on the next iteration. And that rapid iteration, I mean, let's be very clear, like in the course of 5 months, the data, I don't know for sure, but I'm gonna make a reasonable guess that the first set of information that was disseminated on the website you just looked at, Laurance, was probably very small, and each week in this case, we're rapidly iterating to getting the information that's necessary. And we think about price information, getting aggregate information out at the provider level, And then as we see what people want, both policymakers as well as consumers, we can start to iterate. So I think that's just an important lesson that we've learned from the pandemic that we knew beforehand, but has been emphasized.
Maybe I'll put in a plug here. So I think Massachusetts has done a good job. I think, I'm sure there are other examples, but let's point out one more. Governor Raimondo in Rhode Island also has a very robust and interactive dashboard that tracks a whole variety of indicators that I think has also been very powerful. But, this now sort of begs the question. So, we have hopes and pie in the sky ideas, but practically speaking, I'm curious what each of the four of you think are realistic ways forward. What are some, reasonably achievable goals that we might be able to make along the transparency lines, in the midterm future, 1 to 3 years, as we come out of COVID? What is realistic? Who wants to take the first step?
Maybe I'll take the stab at this. One thing that I learned from this challenge is that the underlying data does not have to be that complicated. As you indicate, so many states have been building, have already built, as well as have now publicly available their APCD data. The underlying data that came from this, that, for example, the Massachusetts data that is available, is a relatively straightforward Excel spreadsheet. If you could copy that and 5 more states do it, 3 more states do it, I think that'll be a really important step, because then these data disseminators can start to build that information, use terms that I don't really understand, scrape the data from the web, and then pull that data onto their websites. I think that'd be a really amazing next step. But I think the thing I would emphasize as a first step, the underlying data does not have to be that complicated.
Great.
Just to expand upon that too, I think that, what we can really hope for the future in the next 1 to 3 years is for transparency to become more commonplace. And I think the pandemic and the use of the visualizations that are happening are such an opportunity, and that we have, we can continue to build on that momentum. I also think that linking with other data sources and including geocoding and race and ethnicity data, that's all important to really continue to move things forward. And I think that we can continue to expect the transparency efforts that are out there to become less of a report and more of a tool.
Just speaking for Massachusetts, after releasing our initial tranche of data, we actually did a little bit of a pause, partly because we had some other things in the works, but also partly because we wanted to see what the federal government was going to do. If they're going to mandate things at the national level, that's going to address a lot of the concerns we've had in terms of, multi-state aspects of this, but I suspect there will still be, a need for multi-state collaboration even after we see what the federal government has done. But so I think we need to see what they come up with for mandates. But for Massachusetts, we were going to build on our initial release by following it. It was only outpatient. Other states have done inpatient as well. We were going to enrich the set of procedures, and then we wanted to release it on a regular pace because it's important to see how that information is changing over time. That's also important. So we were going to pursue that. But as I'd mentioned in my earlier remarks, I really think it's important that we focus not just on procedure prices, because frankly, a lot of the cake is baked by that time. Unless you're in a high deductible health plan. We really need to help people, I think, understand the insurance choices they make, because they have profound implications for affordability. And CHIA, through its household survey that we do every other year in Massachusetts, there are, even in a state that has virtually universal insurance coverage, we have some significant problems with affordability. And it's not just poor people, and it's not just sick people. There are real issues around affordability in healthcare, and they can't be solved just with shopping tools. So I think that we need to educate people about the implications of the insurance choices they make. But then we also need to start shining a light of, some of our data tools, once again, not just on this kind of transactional cost at the point of sale, but what are the implications of this? How much money is being spent by people in community, low-income communities versus high-income communities? Start looking at medical spend geographically in some of those lights. So I think consumer price transparency is important. We're just going to keep pushing that once we see what the feds do, but it is by no means the only aspect of the transparency agenda that we need to be pushing.
Thank you, Ray.
Yeah. I don't have much to add other than start. Some of this, as Ateev said, it doesn't have to be particularly complicated. There's there's models out there, and I guess I would say don't start with your own brand new thing. Start with by copying, at least the format that somebody else released, and get something out there. I think that the data that are being released under COVID are just an amazing example. Like COVID Tracking Project harnessed the efforts of thousands of people to go into like every state's website, and they are doing the scraping of different formats and stuff like that. But that's a hopefully once in a lifetime activity that you can generate that much energy around it. As if that were all released in the same format or a common format, it would be much easier for those disseminators that that Ateev talked about to take the data, process it, and turn it into really interesting visualizations. So start, I guess.
That's great. Well, sort of along those lines, I mean, if you were to give advice to other states, what would be the advice that you would give for states who are just embarking on the price transparency path? What advice would each of you give? Who wants to go first? I'd like each of you to answer if you could.
Certainly, maybe I'll build an APCD. I mean, it's not the only way to go about it, but it's certainly it's the right tool for the job, I think, and it has so many other uses that if you don't have one, you should get one.
The other one I would say is don't reinvent the wheel. I think there is, again, and this is, I'm not just criticizing individual states. I think we all tend to do this as a psychological problem, is that we think we got to do this on our own. And there's a lot of great stuff out there. Copy it. Just go what Maine has done, or Oregon has done, or Massachusetts has done. See what they've done and copy it, and then start from there. So as opposed to, because they've gone through several iterations to get to that point. And so that'd be the only thing, is to not reinvent the wheel. I think obviously there are individual needs of residents in different states. I don't deny that, but I think at its basic level, most of the stuff that we have out there is universal across the country. And so again, don't reinvent the wheel, copy others.
And bring consumers and other stakeholders to the table. Like, know who the audience is for what is being put out there. And I think really having those conversations, and while it can be a time-consuming process, things like consumer advisory groups are so critical to keep decision-making on point throughout the entire process, and to keep that audience and the language and how things are described top of mind, as well as how they are visually displayed.
Yeah, it was my sort of thought process was following what Melissa just said, is have the, not the answer, but at least the topic area in mind, and talk to people about what they want to know, what they need to know, and then figure out what data could help answer those questions. So I think, one of the things that is challenging is, as I think Ray mentioned early in the conversation, is for most consumers, the price that's paid to their provider for a particular procedure, there may not be a huge linkage between what they pay, the individual pays out of pocket, and what their provider pays. And so if think about what question you're trying to answer. Are you trying to change consumer behavior, and will this happen? Or are you trying to educate legislators, in which case you may have different data? Are you trying to raise a public conversation around access to care, and access in different geographic areas in your state? You may have different data that are released, but it would be just an understanding of what question you're trying to have people answer would be a good starting point, because I think sometimes we just release data and are like, okay, that's and it may not be useful or particularly to answer particularly interesting questions.
So to summarize, what I think I heard is build an APCD, don't reinvent the wheel, borrow from others' experiments and successes, make sure that you're in touch with your consumer audience and getting feedback from them, and make sure that you fit your data to your use cases. Those all sound like pretty good bits of advice. So
I'll just make one quick point. One of the things we learned from some interviews is that a lot of people really love the price information, not because they want to use it to select their provider, but really they want to plan ahead. So they've decided to have a surgery or have an MRI. It's a little unclear to them. They are a household, they need to budget. So they were using the price transparency website not to figure out where to go, but how much should they budget ahead of time, say they have a high deductible health plan, et cetera. It's a basic insight. It's one of those duh findings after people told us that, but it is really emphasizes what was just said, which is learn what your audience is going to use that information for.
And to just add to that quickly, I think another thing that we're seeing, transparency websites being used for is negotiations between payers and facilities. And I think that is something, when this work started years ago, that probably wasn't a use case that was really top of mind. It was more like, let's get the information out there and get it to the public because people deserve to know the information. And so I think that things do continue to evolve and we can certainly learn from things that have already been done. And also just bringing consumers to the table. While information might be displayed, can be displayed potentially the same across different states, it gets to that dissemination piece of the marketing. How are people getting their information in different states? I think that is something that is different across the country in terms of how people access information. And so that's a really critical thing that I do think is missing from a lot of this work, is really that marketing piece. And that's what we have got to be focusing on.
And there's also the issue of, at least in Massachusetts, by law, health plans have to provide their members not with a cost estimate, but with a binding price prior to a procedure. And also provider organizations have to, within, I think it's 24 or 48 hours, also provide a price to consumers. So there's other, it's not just, consumers can certainly go to their health plan or to a provider organization and seek prices. That's another avenue. And the added advantage of leveraging your health plan is that many of them are offering shopping tools that provide financial incentives for picking one provider organization over another. And that's not something that, for instance, a state government website can do. But if you go to a health plan, they can offer incentives to pick a lower cost provider for a procedure.
So we have a question from the audience that plays right into that, Ray, which says, many insurers do this, that is price transparency, with their internal data and can adjust to cost sharing, et cetera. Why use an APCD? So maybe, Ray, I'll go to you. Yes, has both. Massachusetts has a mandate that an insurer or a provider has to tell you an exact price, yet the state also maintains an APCD-based price transparency website. What's the trade-off between the two?
Well, actually, if you go to the Massachusetts website, the very first thing you're confronted with is a splash screen that says you have the right to get a price information from your insurer, and they have better information than we do. And in fact, they can give you your out-of-pocket prices. So you should, if you have insurance, and virtually everyone does, you should go check there. As I said, we want to get the information out to the public, but we aren't saying that we are the preferred or should be the preferred shopping site. As I said, we've got other potential users. We want consumers to know this information, but we want policymakers to understand provider price variation in the Commonwealth. We think market participants benefit from knowing more about the prices that are paid in the system. So we believe really strongly in getting the information out there. Whether our information is used as a shopping tool, we're somewhat agnostic about that. I mean, we think that the insurance companies in Massachusetts are great insurance companies. By law, they have to provide you with a binding price estimate. And so we want people to know that. And in this state, at least, we think it's important that consumers see that information, certainly in addition to what we're providing. So we embrace that. So in other words, we don't see a dichotomy. It's like we want people to know that. We want them to go see that. If our information is also useful to them, by all means, we're happy to share it.
Yeah, I think the key thing I would emphasize is, first, I don't see those as mutually exclusive. I do think that insurers have information that is available that the APCDs do not. However, I would emphasize a couple things. First is the use of the health plan data is very, very low. And at any of these websites. And some of it is because it's behind firewalls. And as much as the health plans want to think that everyone knows their fillinhealthplan.com website and username and password. People say they don't have that information available, or they can't find it, or it's on some password on some sticky note on their computer at home. You know, we all have that problem of getting in and getting that information. When it's in the public domain and it's disseminated by a lot of organizations, it's going to be that much more accessible and therefore much more likely to be used by the people out there, including policymakers, et cetera. So that firewall doesn't sound like a big deal, but it turns out in reality is a huge deal. The second point that I might make is that trust factor. And in general, in our interviews, as well as some other data, people trust a state website more than they're going to trust their insurer. In this particular case, I don't know why you wouldn't trust your insurer. Your insurer should give you accurate information. I'm not saying that information is not valid. It's rather, but it is the trust factor. So having both of those, I think, is very, very helpful.
So we have just a couple of minutes left. We have another question, which I'll share. I think is very apropos. And then we'll have a moment for wrapping up. Do you have concerns about the privatization or commoditization of the data as disseminated by states? More and more of the National Weather Service data used by companies are hidden behind paywalls, thereby limiting consumer access. And even when they're not, you know, there's banner ads and there's clickbait and other things there. So, you know, if we're going to follow this National Weather Service model and make the data available more broadly, is it a concern? And what do we make of the concerns about how that data will be used?
My perspective is the government always needs to provide a safety net, access to the data. So we would never make our data available exclusively through, a private partner. It's always additive or supplemental to what we do. So, I mean, we want to leverage the ability of people that know more about how to interface with consumers and share data with consumers, but we would never give someone an exclusive. So if somebody likes nationalweatherservice.gov and is happy to get their weather that way, they can. And similarly, CHIA will always make sure that the data we disseminate is available, not just through third parties, but directly from the government for free.
And I think from my perspective, the model's working exactly as designed, where the data are available for free, but people have built valuable services that have built businesses on top of that, driving the economic growth of the country. But they've found people who will pay for whatever value they're adding to it, whether that's, a more granular knowledge of where you are and, very localized weather reports or something like that, that they're able to take the underlying data. Anybody could have taken that data, theoretically at least, and built a really interesting product with that. So from my perspective as an economic development guy, that's working exactly as designed, as long as the data aren't willfully misinterpreted and misused and as long as the data are really available in the public domain.
Great. Well, we're almost at time. We've got about, Ateev, if you want to comment, go ahead quickly, and then I'll give each of you 20 seconds for
maybe this will be my closing. Yeah, maybe this is my closing comment, but also maybe I'll do a twofer. But I just to build on that point is that I hear the issue, and I hear about issues about oversimplification, but I have the other concern is that if you produce, that's the point. And yes, I recognize there's all sorts of nuances and details that need to be, and that in terms of interpreting that data. But I feel that we, at least maybe I'm speaking broadly as both the research, as well as the policy, as well as the plan community, insurance community, put so many caveats and nuances and details that we lose the basic point that the average person out there, legislator or not, or average consumer, can't use the information. And so I appreciate the simplification and making the data more easily interpretable, because that means that people will actually use it. So I just keep on coming back to, it's all about getting the largest number of eyeballs on the information. And if this is a better way to do so, it seems like the right path to go down, given that the current use is so low.
Great, thank you, Ateev. Anybody, quick 10 or 15 second final comment before I give you all thanks? You're good? Well then with that, just say, Appreciate the questions from the audience and really appreciate the work that you all did in this challenge and setting this up and in your conversation today. So please all give a virtual round of applause to our 4 panelists. Thank you.
Thanks everybody. Thank you, John.